Blood flow restriction training is a new treatment technique we're using at Parkview Sports Medicine that helps us stay on the cutting edge. The benefit to the patient is that we can now train at an intensity that we couldn't train at before because of their restrictions or injuries that wouldn't allow us to load their limbs up with a heavy weight. You need that high weight and or high metabolic stress that we get with the blood flow restriction training to propagate those changes like increased strength and increased muscle size. This type of training is not only new to Parkview Sports Medicine, but in physical therapy as a whole. And it's really gaining popularity because it solves one of the fundamental problems that we see in therapy. We have a lot of patients who we can't put a lot of stress through their injured tissue, but we still want them to get stronger and still want them to gain muscle size. So because of the exciting research that says we can get those changes without the heavy loads, blood flow restriction training is the perfect tool to solve that fundamental problem. Blood flow restriction training uses a specialized piece of equipment. It's a tourniquet of sorts that also monitors your blood flow at the same time. Then that tourniquet uses a specific pressure to restrict but not totally restrict your blood flow. Doing that allows the cuff to trap metabolites or lactic acid, the thing that gives you that muscle burn when you're working out, inside your leg. What that does is starts a cascade of metabolic processes that allows you to gain strength and muscle size without actually putting a lot of mechanical stress or heavy lifting through the leg.